quarter of Social Security beneficiaries rely on that for 90% of their income. Also relevant for North Carolina, 48% of North Carolina's private sector workers that are ages 18 to 64 in 2020 were employed by a business that did not offer a retirement plan. So nearly 50% of private sector workers who were employed by a business did not have a retirement plan. So this is important to note for our strategy of helping more North Carolinians plan and save for retirement. The second part here, this B, is to the General Assembly to establish a state-facilitated program to help businesses offer paycheck deductions for retirement savings if they are currently not offering a retirement plan. And I'm going to go back and just highlight some of this data on this slide here, because this is for North Carolinians, and it should not say not covered by small business. This is not covered by a retirement plan in general. So we have this data by race, ethnicity, by income, and by business size. And you can see by business size especially, the smaller the business, the more likely people are to not have access to a retirement plan. So the other point here is that in December 2020, there was a joint legislative study committee on small business retirement options in North Carolina. And the recommendation from that committee was for small businesses in North Carolina to offer payroll deduction retirement savings options for employees through a state facilitated auto RIA program. There are 16 states that have implemented an auto IRA plan such as this, including Virginia, Maryland, Delaware, and Illinois. Additional information, I should say, is also in our report if you want to dig into any of these details. So next I'm going to go to our strategy looking at updating tax policy to help older adults with lower incomes. And when I say our strategy, it's actually the strategy of the task force. These are recommendations from the task force. So North Carolina and many other states exempt all Social Security income from state taxes, regardless of income. And 10 other states exempt Social Security income taxes for some families, depending on the income. Property tax can also be a challenge for older adults, even those who own their home, because they are house rich and cash poor. So that can be an issue. And research indicates that there's a direct relationship between increased property tax burden and older adults moving out of their homes in the community. So we currently have 3 property tax relief programs in North Carolina, and that's the elderly or disabled exclusion, disabled veteran exclusion, and the circuit breaker tax deferment. However, those programs are not widely used. Despite the availability of those, the AARP Foundation estimates that only 8% of eligible older adults are participating in those programs. So the AARP Property Tax Aid Program provides help to eligible homeowners and renters who want to apply for the available property tax relief, and that program is being developed in North Carolina. That's the AARP Foundation Property Tax Aid Program. So this is a strategy that is for the General Assembly to review and update income and property tax policies related to older adults to provide tax relief for those most in need in North Carolina. Strategy 5 is in reducing the cost of healthcare coverage. So for the median retiree, out-of-pocket expenses for healthcare account for a quarter of their Social Security income. High out-of-pocket expenses combined with that reduced income means that they're less likely to use healthcare in general. So the Medicare Savings Program is a program that's available to older adults with low incomes that helps pay for Medicare premiums. And in some cases, it also helps for cost sharing for services. And even though Medicare is a federal program, states have the authority of income threshold for and asset limits for that program. So standard asset limits for the Medicare Savings Program is $8,400 for an individual and $12,600 for a couple, while the limits for full eligibility, which includes coverage of premiums and cost sharing, is $2,000 for an individual and $3,000 for a couple. There are 16 states that have chosen to increase or eliminate the asset limit to qualify for the Medicare savings program. That includes Alabama, Louisiana, and Mississippi, who have eliminated those asset limits completely. So also want to point out that despite the challenges that low-income older adults have with healthcare expenses, many who are eligible for the Medicare savings program do not participate. It's a very similar situation that people don't know about the programs that are out there. So depending on the specific Medicare savings program, as little as 15% of people who are eligible for it are actually participating in that program. So there's a need for greater understanding and awareness of that program. So the strategy here is for the North Carolina General Assembly to increase access to health insurance and reduce costs by using its authority to reduce eligibility requirements for income and asset for the Medicare Savings Program, increasing funding for outreach to inform consumers about the Medicare Savings Program and Part D Extra Help, which is for prescription drug coverage, and then supporting outreach for older adults who now qualify for Medicaid, who might be 65 and under. Next, I want to touch on ensuring a statewide focus on housing availability, affordability, and supports for older adults. So in North Carolina, 14% of housing either lacks a kitchen, lacks plumbing, is overcrowded, or the occupants are cost burdened. But when we look at those who are 62 and older, 29%, so double the households, experience these issues. There's many metro areas where anywhere between 20% to 50% of older adults are cost burdened, either in their homes or as renters. So this is a pretty serious issue for older adults to have access to affordable and safe housing. So this is a recommendation or a strategy to ensure that we focus on this housing issue. The first part of this is to fulfill a Governor's Advisory Council on Aging recommendation to the Department of Health and Human Services for them to conduct a comprehensive needs assessment of housing statewide to see where we're at and where we need to be for our older adult population. And then for the General Assembly, the Office of the Governor and the North Carolina Housing Finance Agency to work to review the results of that assessment and understand what are those policy implications and ways that we can address some of these housing problems. Next, we've got looking at the culture of aging. So this is as we're thinking about as we grow older, we are all aging. This is not just an issue for older adults. This is an issue for all of us. We want to think about aging as a lifespan issue. So there are a couple of things here that are relevant for the General Assembly. So ensuring a legislative attention to aging issues. So given that we have this growing older adult population in North Carolina and many urgent issues facing the population, the task force wants to ensure that there's the legislative committee structure is adequate to provide attention and action that's needed to meet modern and future needs of North Carolina's older adults. Going to skip forward to community services and programs. So we have many great community services and programs for older adults in North Carolina already. So we're thinking about how do we ensure that there's access to those programs across the state for all older adults who might need them. So recommendations in this strategy center on strengthening those existing programs, including aging in our local public health and hospital community health assessments, and connecting healthcare with aging issues. I'm going to focus on that first topic area. So strategy 17 looks at strengthening our local senior centers. So senior centers offer a wide variety of services and programs that can include all of these listed here, but they're not limited to those. So we have things like information and referrals for older adults, legal assistance, getting home delivered meals, and then all of those kind of congregate activities, educational classes, retirement planning, support groups, that kind of thing. So participation in senior center activities is associated with a variety of benefits for older adults, including lower levels of depression, increased supportive friendships, lower levels of stress, and improved perceptions of social and physical health. So this graph shows that state senior center general purpose funding in the gray bars has decreased by 18% since 2004 when adjusted for inflation, while the population of people age 60 and older has grown by 82% during the same time. That red line is the population of older adults. You might notice also that sometimes we reference 60 and older, 62 and older, 65 and older. That is because oftentimes there's not an agreement on what older adult actually is defined as, so our data has different definitions, but I just wanted to note that. So senior centers are typically funded through 3 to 8 different funding sources. Those can include municipal or county government tax dollars, federal and state government, fundraising events, grants, participant contributions, in-kind donations, and volunteer time. So in North Carolina, the senior center general purpose funding is allocated from the state to area agencies on aging to distribute to local senior centers. So the recommendation here, which is supporting a strategy from the North Carolina Senior Tar Heel Legislature, is for the North Carolina General Assembly to strengthen the ability of senior centers to provide those vital connections and supports and activities for older adults by increasing funding by $1.26 million. That is the Senior Tar Heel legislative priority. As well as part of that funding, to look at and request a review of the senior center certification program to ensure that it is incentivizing the things that we would like senior centers to be doing. So one purpose of the general purpose funding that goes to senior centers is to incentivize them to complete a state certification process to increase their base funding levels. So funding levels are determined by the center status of a center of merit or a center of excellence, and then funds are required at a 25% local match. So next we've got strategy 18, which is to increase access to the program for all-inclusive care for the elderly, or PACE. So PACE is a innovative, community-based managed care program for older adults with complex medical needs. The program provides integrative preventive care, acute care, and long-term care services in the community setting. And PACE centers provide services that include transportation, meals, dentistry, primary care, and behavioral health. In order to qualify for PACE, you need to be age 55 and older. You need to be certified to need nursing home care, living in a PACE service area, and able to live safely in the community while receiving those PACE services. So again, these are individuals who could be living in nursing facilities but are able to live in the community because of these services that they're receiving. So this map shows that there are currently 11 PACE organizations that operate in 12 different areas around the state. They serve a total of about 2,100 people. So much of eastern North Carolina that's not colored on this map, and the mountain areas are not served by a PACE organization. So the strategy here is to have the General Assembly increase access to PACE by fulfilling the recommendation of the Governor's Advisory Council on Aging to expand the program availability throughout the state. Excuse me, I lost my notes there. Okay, and then next is conducting research and evaluation on current programs to increase access. So this is specifically looking at adult day health programs. There's multiple areas of research that are important, but this is the one that's specific to the General Assembly. So adult day health programs provide a coordinated program of professional service for adults in community-based group settings. They have services designed for social and some health services for people who need supervision during the day, and it allows their caregiver to go to work or get respite care. And those services can include social activities, transportation, meals and snacks, personal care, and therapeutic activities. And studies show that participants in these adult day health programs experience improvements in physical and emotional problems and perceived well-being, as well as positive changes in social support and quality of life. So this strategy is to look at before I say that, one challenge in North Carolina is that only around half of counties have an adult day health program available. So that drastically limits the number of people who have access to this type of service. And we don't have very good information about the landscape of adult day health programs in North Carolina. What is their funding like? What kinds of needs do they have? And so an evaluation is needed. The task force felt like they could not make a recommendation specific to adult day health programs because that data was lacking. So the request is for the General Assembly to fund a study to understand adult day health program landscape, how to expand to rural areas, what funding is currently in that landscape now, and a few other issues relevant to adult day health programs. Next, I'm going to talk about modernizing the Home and Community Care Block Grant. So the Home and Community Care Block Grant was established by the North Carolina General Statute and became effective in 1992. So the Division of Aging administers this block grant, and it's made up of funds from the Older Americans Act. That's about 45% of the funds, and then state and local funds. So each county is required to provide 10% of the block grant funds. Area agencies on aging monitor the programs that are receiving the block grant funding. And this graph shows that when adjusting for inflation, again, looking at that population growth and the block grant funding, we see that the appropriations for the block grant funding from the state have decreased about 10% since 2004, while that older adult population has increased. Next, we're going to look at, these are the services that are provided through the block grant funding. So we have things like congregate nutrition, home delivered meals, the adult day care services, senior companions, transportation, a lot of really important services that help people to stay in the community. So there's 18 total allowable services, and each county provides some but not all of those services, depending on what their funding is. Eligibility criteria for an individual to receive services through block grant funding is that the person is age 60 and older, and they're unpaid primary caregiver. And they're generally based on the functional need of the individual who's receiving the service. So in fiscal year 2021-2022, about 88,000 people were assisted through home and community care block grant services. Primarily, those are nutrition-based services. So about 71,000 of those 88,000 were nutrition services. And there was a total of $101 million in funds dedicated to those services, with $34 million of that coming from the state. Okay, so looking at the recommendation from the task force, it is a request to the General Assembly to fulfill, again, a senior Tar Heel legislative priority to increase the recurring state funding for the Home and Community Care Block Grant to $8 million. Also to look at to fund the Division of Aging to study how they pay their providers and kind of modernize how they pay the providers who are receiving these block grant funds, as well as modernizing the management, the computer management system for those funds. Next, looking at adult protective services. So when we talk about adult protective services, we are talking about services, and this is in the quote box, services provided to ensure the safety and well-being of elders and adults with disabilities who are in danger of being mistreated or neglected, are unable to take care of themselves or protect themselves from harm, and have no one to assist them. So according to a UNC School of Government initiative, at least 10% of elders are abused in some way each year, including physical abuse, financial fraud, scams, caregiver neglect, psychological abuse, and sexual abuse. So Adult Protective Services statute in North Carolina was developed to help older adults when they're not able to take care of themselves. And if they have no one able to assist them for essential services. The law was written in 1975 and it has not been updated since 1975. Currently, the Division of Aging is engaged in a improvement project for Adult Protective Services to address some reform needs. And one area that current law does not address is self-neglect and other forms of maltreatment with early action. So identifying early ways to help people who might be experiencing neglect. An example of a state that has tried to address this issue is Colorado. So in Colorado, the Adult Protective Service is piloting a program that meets this need through alternative response to low-risk allegations. So they have opportunities for the Adult Protective Services staff, clients, and their families to work together to meet the needs of those at-risk adults. So the recommendation from this task force here is another senior Tar Heel priority. This is to work with the Adult Protective Services and other partners to evaluate the current state statute for Adult Protective Services to identify opportunities for modernization and funding, and fulfilling the legislative priority, the senior Tar Heel legislative priority in increasing those funds to $8 million. We're going to talk about one area of workforce that's really important for the older adult population, and that's family caregivers. So there are other areas of workforce that have recommendations, but they are not specific to the General Assembly. So there's looking at the aging network. So the people that work in aging services, do we have an adequate workforce going into the future? What are our needs there? Ensuring that people who work in the community, maybe not in aging services, but in places like transportation or in emergency management, making sure that they are equipped to work with older adults going into the future, and also improving the ability of community health workers to work with older adults. But I'm going to focus on the family caregivers here. So there are about 1.28 million family caregivers in North Carolina who provide about 1 billion hours of care per year. So 1.28 million caregivers. Family caregivers are typically uncompensated and often have physical, emotional, and financial challenges resulting from their caregiving. Nationally, around 30% of caregivers are in a sandwich generation. So they're not only caregivers to an older adult or an adult with disabilities, but also to a child or a child with disabilities. And most family caregivers work either full or part-time, with a majority, about 54%, working hourly wage positions. So this is a recommendation to the General Assembly to support older adult employees and caregivers, and caregivers of people with disabilities by implementing family and medical leave for all state employees, adopting policies like family medical leave insurance, and requirements that employers allow employees to earn a minimum number of paid sick days or personal leave days, allowing them to have flexibility without penalty for using those days. Exploring policies that support business owners who want to adopt family-friendly workplace policies, and exploring policies to support counseling and support services for family caregivers. So that is the general gist of all of the recommendations from this task force that are relevant to the General Assembly. I want to just call attention that we were doing this work with the task force at the same time that Governor Cooper had the state commit to being an age-friendly state, and the Division of Aging is working on a multi-sector plan for aging called All Ages, All Stages, and they're using work from this task force to help prioritize work for that multi-sector plan on aging. So we're seeing a lot of movement in this direction and excitement around aging in the state, and look forward to hearing about the movement in the future. So if you would like to reach out to me with any questions or I can help make connections with anybody from the task force. My email is up here, and I'm happy to also answer any questions.
Thank you, Brieanne. That's a wonderful presentation. I learned a lot, especially about the age differences there. I kept hoping that you'd keep bumping up there so I could stay young, but when you got up to the 65 and I'm 69, I said, well, I guess I'm getting left out. Now, except for my co-chair, he's not a day over 55. Anyhow, any questions from the committee?
Mr. Chairman.
Yes, recognized.
Speak. Question for Ms. McDonald.
You're going to use the mic right here.
What aging in the rural areas, urban areas, which I know they all are difficult, but what have you found in your studies to be the different challenges, rural, aging in Raleigh, aging in a rural community?
State your name before you.
I'm sorry, thank you. Brieanne Lyda-McDonald, NCIOM. The real challenge in rural areas is the lack of services. And that was, I think, depicted in the PACE map that I showed. And the reason why there's a challenge for PACE to operate in those rural areas is for those coordinated services to get together, and there's the startup funding to do that kind of thing. So that's part of the issue of aging in a rural area. Another issue is transportation. When we have all of our services and things far apart, and getting that kind of, if you don't have public transportation, getting that door-to-door service can be a challenge in rural areas. I think in urban areas, there might also still be challenges around funding for services and just knowing about the services. Yeah. All of these statistics of we have great community services and programs sometimes that aren't used. And so making sure that there's connections to those programs when people need them, I think is applicable for rural and urban areas. But I think the rural areas are really where we're going to see the biggest challenges.
Just one follow-up, Mr. Chairman.
Yes, go ahead.
When seniors seniors have their own way to get a certain age, when they seem to want to just live like they live and don't want to be bothered, what responsibility does a community have, whether it be social service or any other agency, to, I hate to use the word insist, just how do you answer that? Because I think you even said that
right.
Some people just choose, they don't want to be bothered, but we know as a community they should not be living in certain type of conditions and going through certain things. How does a community engage that, if you don't mind?
So I think from the perspective, I'm sorry, thank you. Brieanne Lyda-McDonald, I'm not used to this. I think our task force would say that we want people to have the opportunity to be able to meet their needs. So people can make choices, but sometimes those choices are very limited. So if people have the opportunity to access safe and affordable housing and they choose not to, that is a choice, yes, potentially. But often that is not even a choice that's available to people if they don't have access to those services. When we're thinking about adult protective services, I think we want people to have an opportunity to address an issue they might be having and help to do that. But if they decline that help, then that would be their choice to do that. But I think that the task force would say we want people to have the choice.
Yes. Thank you.
Yeah.
Thank you, Mr. Chairman.
Yeah, thank you. I'll elaborate just a little bit. You're talking about Representative Pierce, the availability, and up in the mountains where I'm from, that's one of the issues we have there is the sparseness of the population and getting that population that needs those kinds of services. And we're seeing a change in the growth, and we're recognizing by 2035 the senior population, and that's including 60 on up.
Yep.
And we're trying to be more than the 18-year-olds.
In almost every county. Yeah.
Yes, in almost every county in the state. So we do have some issues. Anyone else have a question? Representative Lowry, recognized.
Thank you, Mr. Chairman. We'll have more of a comment than a question, if that's all right, Mr. Chairman.
Go right ahead, sir.
So the recommendation number 1, helping older adults retain more financial and material resources to support healthy aging. There's a bill that I filed, H496, Work and Save, which would help address some of this, helping make sure that folks, that 48% of North Carolinians who work in private sector jobs that have no way to save at work. I like all my members to look at that when you get a chance. Once again, it's H496, which would help address at least recommendation number 1. And thank you for the committee for all the work that they do.
Thank you, Representative Lowry. Any other questions from the committee at this time? Sergeant Arms, you had? Oh, Representative Green, I'm sorry. Go ahead.
Yes, sir. Thank you for your presentation. I think this is an important issue, and you were talking about a lot of the programs that are underused, and probably from lack of knowledge that the programs are out there. Have you identified any strategies to try to help spread the word about them?
I think that Brieanne Lyda-McDonald. Thank you. Yes. So part of what I didn't mention here is that there needs to be some additional work to identify the best strategies. But there are central hubs, right? So senior centers are a great place. Medical offices are potentially a great place to identify those strategies. And I think there's work in healthcare to try to start to connect people to services like that. More work could be done. And then I think the kind of educating the community at those central hubs is really one of the biggest things. But additional work is needed to figure out how are we actually making sure that people know what's out there.
Follow up.
Just
Recognize Mr. Smith.
Thank you, Mr. Chair, and thank you for the presentation. I did have a couple questions on the, I guess within the 30-second slide, you mentioned, I guess the age of the North Carolina APS statute and current law not reflecting or not addressing self-neglect and maltreatment with early action. What is meant by the early action? My understanding of APS, CPS is those entities, they operate after a report is made. So, presumably if they're responding to an adult, it's an adult that has, maybe there's some weird financial withdrawals or, they're not taking medication. There's a report of malnourishment or just a lack of cleanliness maybe. So, by the time they're receiving a report, I guess my point is they're not terribly preventative or proactive. They kind of respond once something has already occurred. So what is meant by that early action is sort of my question.
Brieanne Lyda-McDonald. So forgive me because I don't know a lot about the deep details of adult protective services. My understanding is that currently it needs to meet a certain threshold in order to start a process, and that threshold is fairly high. So it would be a matter of kind of creating a way for those lower risk situations to be addressed in a kind of lower supports strategy. And we have a couple examples, I think, in the report. Colorado is one of those that has implemented a kind of pilot system. I'm sorry, I don't know enough details, I think, to answer your question in a full way.
No, I appreciate your answer, and I'll take a look at the report. Follow up, Mr. Chair.
Yes, go ahead.
Another, and you sort of hit on this when you look at the map, the PACE map and the PACE entities, assuming, how do we facilitate the increase to access? I mean, you sort of touched on it, but especially in rural counties, I understand that in Cumberland County, I'm from Fayetteville, we have the St. Joseph of the Pines. And I'm assuming here, I don't know, but the folks they serve, maybe they could pick up multiple people in one trip and take them to a similar appointment. I just think that's harder in rural areas when people live farther apart and the service providers are farther apart. So I would think it would cost more or require more, more transportation vehicles or workers. Have we thought about, we certainly want to provide these services in rural areas, but, do we have a plan for the logistical, just the reality of the logistical, restrictions?
Brieanne Lyda-McDonald. So I would say the startup funding seems to be one of the bigger challenges in places that are more rural or don't have a PACE program currently. So there's kind of that piece of it. And then I think there's probably some component of a economy of scale, right? Of how are you going to get enough people and what is the kind of efficiency you can get in a certain area. I would refer you to the PACE program director for more details, because she was on our task force and really helpful with thinking through those ideas. And there's probably a few more details in the report as well. But I think she would be a great resource for thinking through what that could look like.
Sure. Thank you. And one more question, Mr. Chair, if that's okay. Earlier in the presentation, you were discussing state facilitated programs to help businesses offer paycheck deductions. I think you mentioned 15, 16 states that have sort of implemented these programs. Once established, are businesses entering into the programs? Are there incentives? Do these states, are they offering incentives for businesses to enroll to offer the paycheck deductions?
I cannot, Brieanne Lyda-McDonald, I cannot answer that. And I think it's possible that data was not available in terms of how have those programs been implemented, because they're fairly new. So I don't have the data to answer you right now.
Okay. Yeah. Thank you.
Andy?
So one more question. You want to go ahead, Representative?
Go ahead, Representative Mark.
Thank you. Thanks a lot for your presentation. One program that I know is really successful is Meals on Wheels. I know it's mentioned in here. 41,000 seems like a low number that's being served. Is that running statewide, and is the state providing any funding for that, or is it just all non-for-profit volunteer?
Can you repeat the question? Brieanne Lyda-McDonald. I wish I could answer that question, but I don't know for sure. I'm looking to my colleague because she might remember the details a little bit more, because she wrote the issue brief that is also in front of you about adult nutrition. I believe it operates statewide, but I don't know for certain where their funding comes from. Yeah.
Okay. May I ask if the group would gather that information
Yes.
from representative and provide that to all the members of the group?
Yeah.
Representative Pierce.
Mr. McDonald, one other question. The veteran community, I had to step out for a call from a nursing facility when I stepped down. But what are you hearing? Is there anything much in your research as it relates to veterans just across the state? I know they get the VA hospital, but still there seems to be some challenges. Even in my office, I get calls about not getting the care. Was there anything that you ran across in your study on veterans?
We did not focus.
Aging veterans at that.
Brieanne Lyda-McDonald. We did not focus at all on that population, and we know it's a very important population, and are hoping to do some work in the near future, I think, on that topic.
Thank you.
Okay. Any other questions from committee? Let me make a comment there, talking about the connection of all the programs available, et cetera. From my experience, from my rural area, it has a lot to do with the technology challenges of the folks. When I say back home, not that we don't have cell phones. Some of us still have flip phones there, Representative Pierce. But point being with that is they rely on the local newspaper. Bad to say or good to say that people do still read newspapers, and that is an avenue that this information can be disseminated out. in whatever fashion necessary with that. So go ahead. Yes, ma'am. You're recognized.
Brieanne Lyda-McDonald. Thank you for bringing that up about technology, because I think to the question earlier also about rural versus urban and challenges, when we think about internet connection, this is pretty relevant to older adults, even though sometimes we discount the importance of technology for older adults, because we're going to be able to use technology more and more to keep social connections, to access services through our smartphones or things like that, to call on drivers, that kind of thing. So we do point out in the report the importance of access to internet, high-speed internet in rural areas in North Carolina, and how that's connected to those issues for older adults.
Okay, thank you for that. Sergeant Arms, do you have any public comments or anyone from the public like to make questions? Well, it appears committee that...
Chairman,
Oh, yes.
I asked one of our guests a question, Mrs.
Sure.
Ms. Mary.
Come to the mic and be recognized, please.
Thank you.
I'm Mary Bethel. I've worked in aging in 45 years in North Carolina. I'm currently retired, but I'm also co-lead for the All Ages, All Stages NC plan that's been developed.
The question I had, Mr. Chairman, was, have you found out, Ms. Mary, I know you've been this a long time, been working with you, what are we doing to just really keep, a lot of seniors want to stay home and away from our, it's nothing wrong, but are we at that area where we are able to assist the aging community to stay in the environment that they are familiar with? Are we there? Are we kind of moving backwards? Where are we at? If you just that, where are we at that the stage?
Mary Bethel. I don't think we're there, and I've been working in this field for a long time. One of our priorities that we have in North Carolina is try to ensure a continuum of care in every community in North Carolina, no matter where people live. And that would include if you need, say, home delivered meals, if you need in-home care, if you need assisted living, if you need nursing home care. Very few communities in North Carolina can say they offer that. Now, I think, as you said, most people want to stay at home. We rely a lot on family caregivers to provide that support to families to keep the people in the homes as long as possible. Most communities try to cobble together enough services and resources to help people to the extent they can. But to say that we are able to offer people the opportunity to choose what they want to, when they want to, we're probably not there in most communities in North Carolina. And a couple of things have been mentioned today about that are really critical to that. You talk about housing. Housing is really critical. As Brieanne said, we've got a lot of people who are house rich, cash poor. We've got a lot of people who have, say, big houses, but they're falling apart around them. We've got people that can't drive anymore or don't need to be driving anymore. And when you lose that ability to drive, there goes your mobility and the ability to be independent and to do those things that help to keep you engaged in the community. You mentioned, Representative Pierce, the idea about people just kind of that maybe need help, that just kind of maybe get stuck. Well, the whole issue of isolation and loneliness and can lead to depression, things of that nature. So there's a whole lot of things that are at work here. And one of the things that I think is really being done lately, and the demographics are driving this. I've been around a long time. We tried to do a plan on aging 22 years ago where we said North Carolina needs to be responsive. It pretty much fell on deaf ears. And the reason why, the demographics were not what they are today. But if with the demographics being what they are today, if we don't begin to address some of these issues, they're going to bite us in the rear end. One of the big issues is paying and having access to long-term care. Research shows that probably 60 to 70% of people are going to need some type of long-term care before they die. Now, this could be in their home. It could just be something simple as an aide coming in or things like that. But how are we going to afford to pay for those types of things? Brieanne mentioned that most people don't have savings accounts anymore. So is it fair to say that this is going to be a government responsibility to do that when we're already struggling to pay for what we have this day and time? So as a state, I think we need to think proactively about how we can begin to address these issues that are there. So that was a long answer, sorry.
Thank you, ma'am. Appreciate the comments with that. And yes, committee, age is one of those identifying factors that we almost all of us have to live and deal with. I think there's a charge to the committee today, and two of the charges are, one is identify funding at some point that we're going to have to take and figure out some vehicle and mechanism to be able to take and accomplish these goals that's been identified. And the second charge to the committee is, since 75, we have not had any changes in adult protective services. And I think that will be another charge to our committee that we should take and encompass and be considering and looking at those statutes to what we can do to better that and encompass those recommendations from it. Any other comments or anything good for the committee at this time?
Mr. Chair, if I may, Mary Bethel, you had a question about home delivered meals I probably could shed some light on if you would like me to.
Yes, ma'am, go right ahead.
Okay. Home delivered meals is probably the #1 funded service for the Home and Community Care Block Grant in North Carolina. So you do have when I worked for the state for 30 years before I went to ARP for 10 and then North Carolina Coalition on Aging. Every county in North Carolina when I left had home delivered meals program. They had programs that just didn't receive government funded, and I believe that program now is taking government funding. But home delivered meals programs, they do state, federal, and local dollars for the most part. Many of them rely on volunteer contributions, and many of them do great fundraising opportunities. So they all cobble together a lot of resources in order to do things. So it's a program that's very popular with folks. You get great community volunteers, they're engaged, but it's the type of thing that we probably could do more resources to. Thank you.
Okay, thank you, ma'am. With that, we're in about 4 minutes of the 3 o'clock hour. I will adjourn this meeting. Thank you for everybody's participation.